everyone to another biology class of Fun Scholar. So today after a long time we are back with another chapter, that is health organization. This chapter falls under ICSE class 9. So let's discuss this chapter. This is a brief chapter regarding the two health organizations, that is WHO and Red Cross Society basically, but we'll be dealing the details about these two health organizations, and we will also look into the different areas starting from villages to the big metropolitan cities in which health organizations work, and what are the things that they monitor, or basically what is the significance of such health organizations at each level of organization. So let's begin. Now, coming to health concerns in India. According to the definition given by WHO, we know that health is the state of complete physical, social and mental well-being, and not merely the absence of diseases or infirmity. So according to that definition, health is a key concern because we need to look into overall things for discussing health. It's not that if a person is disease free, then that person is okay. Maybe that person is under stress. That also need to be looked over. That is why health is a key concern for governments worldwide. Now, steps are taken both at the national level as well as at the global level to ensure the health of the people. So that is the hierarchy. Means it starts with you. Means personal level, then community level, then it will go to the national level, and at large at the global level. So there is a hierarchy, but it will start with the personal level. So if each and every one of us takes care of our own health, definitely the health of the world as a whole is going to improve. Now, this lesson will introduce, as I said earlier also, two major health organizations dedicated to health. Those are number one, Red Cross Society, and number two, World Health Organization or WHO. Now, before discussing both of these health organizations, as I said, we'll discuss different types of habitats in India. I also said that there are different habitats, like villages, towns, cities, then metropolitan cities. And why are these segregated in such a manner? Because according to this segregation, the health status of the residents dwelling in such areas, they also vary in their degree. For example, the health status of the people living in the slum area, that is the poorest, because they are not at all aware of the basic amenities which are required to maintain a daily life. Then comes the village people who are a bit of aware but not up to the level. Then comes the town people who are more aware than the village people. In this way, the hierarchy goes on from the slum level to the metropolitan city level. So, according to the area that you or I are dwelling in, so the status of health will vary. That is why and the prime concern of health varies according to the area that we are living in. For example, as I said, that for the people living in the slum area, their main concern is the accessibility to the basic amenities, such as the clean drinking water. Then we have got the clean toilets, and then we have got the availability of safe and hygienic medicines. So all these things, they are the prime concern. But for the people dwelling in the large cities, so there pollution is the main concern, because we know in the metropolitan cities pollution of water, air, land, or whatever it is a big concern, and accordingly we have got our own problems. So different areas face different types of health issues that we will now see subsequently. Now, health challenges in big cities. So coming to the health challenges in the big cities. What happens in the big cities? We know that they are overcrowded because people from the surrounding areas or from the outskirts, they actually come over here in search of the better opportunities of education or job, and they settle down here. In this manner, the big cities get overcrowded. Then with multi-storied buildings, because the land area is overcrowded, so definitely the vertical height or the vertical area is utilized, so there will be many multi-storied buildings. And heavy traffic, as I said, in metropolitan cities and big cities, pollution is the main concern. Overburdened water and sewage system. Now the drinking water system is overexploited, then the sewage system or the waste generation system, that is also heavily burdened, because so many people are dwelling in per square foot area. So therefore the availability of the basic facilities as well as the discharge of the waste, that becomes very crucial matter. Industrial pollution from nearby factories, because we know in the big cities there are so many factories and industries, they are set up. Both urbanization and then industrialization, they lead to the progress, but side by side they also lead to a lot of pollution. We cannot overlook the other side of the coin of this type of development also. Frequent health problems such as respiratory issues due to the harmful effluents or the emissions from the industries, they cause respiratory issues, waterborne diseases due to the improper or overburdened sewage system. So these are the concerns in the big cities. Coming to the small towns, so what happens in the small towns? There the area is less crowded as compared to the big or metropolitan cities, but still face significant health challenges. For which reason? That we will see, because basic sanitation and infrastructure problems persist. Now, as I said, the disposal, waste is generated, but how to dispose that waste? There should be proper landfill area, there should be proper water treatment area, or we say sewage treatment plant, there should be proper incinerators, but all these facilities are missing in the small towns. That is why all these small towns face basic sanitation and infrastructure problems. So what happens there? All the waste, they are either dumped in a dump yard, and those dump yards become the breeding ground of many types of vectors or many types of insects who become the carriers of germs, and in this way the diseases spread from the infected person to the healthy person. And there the common health problems that the people encounter include infectious diseases due to lack of health facilities. Now you will see in small towns sanitation facility is also not properly maintained even in the hospitals or in the health centers. So therefore the people or the patients who are admitted over there, they are facing infections and their health is jeopardized due to the lack of basic knowledge or lack of maintenance of such health infrastructures. So it is not a big deal to build a health infrastructure, but the main deal lies in maintenance of the hygienic facilities and sanitation. The toilet should be cleaned on a regular basis. The patients suffering from infectious diseases should be isolated, and the rooms where infectious diseases patients they are staying, so those rooms should be cleaned, and those rooms, after those patients get cured, those rooms should be sprayed with the repellents, so that the diseases or the germs from those rooms do not spread to the entire building. So all this, the availability of the disposable items such as gloves, needles, then bandages, so that no medical item is used again after it is used for a single patient. All these things should be looked after, but for these small towns, these facilities are overlooked, and hence we can see the spread of infectious diseases due to lack of these maintenance facilities. Coming to the villages, we know villages have got small populations. They are mainly agricultural based livelihoods. Now, agriculture will include both farming as well as rearing of livestock, such as dairy, poultry, all these things. Now, there you will see the infrastructure is very poor. Obviously, the health officers or the medical officers, they are not so well versed, they are not so knowledgeable, and there are a lot of malpractices also can be seen, because the people there, they are not aware. So whatever will be told to them, they believe in that hearsay and follow that blindly. Hence there should be awareness among the people. There should be more and more camps held by the efficient doctors, so that people are made aware of the basic facilities or the basic healthy and hygienic habits that should be maintained on a regular basis, so that they can stay away from infectious diseases as far as possible. Medical facilities are scarce or far away. We have already noticed that in villages, the people who are suffering from deadly diseases, they do not have any facility of treatment or conducting any test. So for that, they have to travel long distances to the cities or to the towns far away. So they don't have any facility over there to get the test done or the disease to be treated, and that becomes a major issue. Sometimes we have seen that during natural calamities such as flood or landslides, when the roads are blocked, so then the pregnant women also, they are carried by bullock carts or by any other vehicle to the hospitals which could be situated miles away. So that becomes a very pathetic condition for the villagers living over there. So there also infrastructure and medical facilities, they are the reasons for the suffering of the people, and more so because people are not aware. So therefore, health issues such as malnutrition, waterborne diseases, and lack of prenatal care, these are rampant in the villages. Malnutrition, because people are not aware that which type of food they should take at which stage of life. For example, for the infants, for the growing child, or for an adult, what type of, there is no provision of any good nutritionist who can explain the need of a particular type of diet to them. So therefore, they follow a single type of diet most of the time for all the members of the family, which is not at all suitable, because according to the need of the body of each person and according to the age, every person has got a particular diet. But since village people are not aware, they mainly focus on the staple food, which consists mainly of the more carbohydrate based rice, roti, and that chapati, and they actually let go of vitamins and mineral rich fruits and other types of vegetables which may otherwise be nutritious for their health. Waterborne diseases, because they do not have a proper sewage system also, the drinking water that they take, that is not properly filtered, that carry a lot of germs and from which they are infected. And then lack of prenatal care. So therefore, as I already explained, the situation of pregnant ladies, that they are not properly taken care of because people are not aware. So in villages, mainly the problems crop up due to the lack of knowledge. Now coming to the remote areas, which are usually inhabited by the tribal groups, and they rely solely on nature, means forest and forest products. They cannot cook their own food as of now also, so they are totally dependent on nature. They do not have access even to clean drinking water and basic amenities. So they rely on the streams that flow through the forest, or they rely on the rainwater, or they rely on the wells or the natural springs over there. So therefore there is no question of filtration. They take the water directly for any type of use, either for bathing or for their consumption. And if that water is contaminated in any way, so definitely these groups suffer from diseases. And the health issues, they are related to the diseases faced by the villagers, that is malnutrition, then diseases which could be prevented if they had proper knowledge and proper hygienic practices would have been maintained. Then high infant mortality, because they don't know how to take care of the infant after that baby is born, or also how to take care of the mother when she is pregnant or after the delivery of the child. So lack of medical knowledge is again the issue here for their suffering. Slum dwellings, as you can see in the slums, which is very common on the outskirts of the cities, because there the desolate people live who have nothing, and they actually dwell on the outskirts of the city so that they can get somewhat access to the facilities. For example, the electricity line, they actually steal the electricity line with the help of any wire or anything. So they are not entitled, or they do not pay the electricity bill, but they do some type of arrangements so that they can get the electricity in their dilapidated homes. Then they are also definitely overcrowded, and they live in unhygienic conditions because they actually urinate or they defecate in the open places, and the vectors such as the mosquitoes, the flies, they sit on those excreted products, and then again if they come in contact with the food that they take in, then they spread the diseases. And they do not have access to basic sanitation also. So poor living conditions lead to frequent health problems in the slum dwellers. Now it is very easy for the infectious diseases to spread in such slum dwellings, because the houses, they are very much near to each other. So if one member of the family is infected, there is no space to isolate that member. Hence all the members of the family, and from that family other families in the vicinity, all are affected altogether. So in this way, infectious diseases spread rapidly in the slum dwellings, And there is definitely malnutrition because they are not aware of the health conditions. So even if they are infected, they are not aware, they do not know when to, or they do not have that amenities, or they do not have the money to consult a doctor and then take proper treatment. Also, they do not have that proper family planning, and they give birth to many children. And so when many children are given birth, so the children do not, and they do not have proper gap in between the two consecutive children. So then, due to the lack of recovery in the mother's body, the subsequent child suffers from malnutrition. So that is why they are not aware of the family planning programs, how to refrain from having more children. Their belief system is somewhat different. They believe that more children means more hands of income, but on the other hand, they forget that more children means more liability, more responsibility. And since they do not have so much money to take care of children, so definitely either they are going to die at the early stage, or they are going to suffer from diseases. But in either case, they are not going to live a healthy life. Then poor access to healthcare. So doctors and nurses, they also do not, they show interest to go to the slum dwellings and treat them. So even if they come to the primary health centers, they are not provided with so much better treatment, because doctors and nurses, they know that they cannot provide the money. So the government services that is open to all, but unfortunately they are also not given such access to the government services, and hence they suffer. Only if sometimes one or two campaigns they are launched, so if they can benefit from that. Otherwise, due to the lack of knowledge or due to the access to basic healthcare facilities, they suffer from diseases. Now, major health problems. Two main types of health problems we can see. One is the food and waterborne diseases. It is the, we can say, vector-borne diseases also, because food and water is contaminated by the vectors or the disease causing organisms who carry the germs, or the who carry the positive organisms of the diseases from any other source, or to the food or the water that we are intaking. And next category is insect and airborne diseases. Now, due to the bite of the insect, or airborne diseases means which is spread by sputum or by droplets when we sneeze or cough. So therefore, it is always advised to cover our nose and mouth whenever we are sneezing and coughing. So we will discuss them in detail. Food and waterborne diseases. So the common diseases which come under this category, they are diarrhea, gastroenteritis, typhoid, dysentery, all these things. Now, these diseases are mainly caused either by bacteria or by protozoa. For example, typhoid is caused by Salmonella typhi. Then we have got cholera, that is caused by Vibrio cholerae. Then we have got dysentery, or we can say amoebic dysentery, that is caused by the protozoa called Entamoeba histolytica. So all these things are either caused by mainly bacteria or by protozoa, and the causes are contaminated water from well, hand pumps or untreated sources, or industrial effluents which ultimately go into the nearby water bodies and pollute that. Now, these water bodies, whenever water is taken for drinking from these water bodies, only filtration is not enough to kill all the or to remove all the dissolved harmful substances from the untreated source. We need the help of some chemicals or some biotic agents who can actually treat or remove the dissolved substances also, so that it is fit for consumption. That is why proper sewage treatment plant, STP, or water treatment plant should be installed in each city or in each type of habitat that we have just seen, so that water is not only filtered but properly treated along with removal of the dissolved harmful substances, so that we can avoid these type of food and waterborne diseases. Now coming to next category, that is insect and airborne diseases. Poor hygienic conditions leads to the breeding. As I said, in the dump yards, they actually act as the breeding ground for such type of insects. Also, stagnant water. It is always advised, particularly in the monsoon season, not to keep any source of stagnant water inside your house or outside or in the corridor or in the terrace, means in and around your house, because that will become the breeding ground for the mosquitoes, and mosquitoes will spread diseases such as malaria, dengue, chikungunya. And also houseflies and other insects, they can also lay their eggs and they multiply and they spread their diseases by carrying the germs from the excreted products or from the contaminated food and water or from the infected person inside your house. And it should also be looked after that we actually prohibit the entry of such insects. We know nowadays we can use so many mosquito repellents. We have got sprays, we have got liquids, we can use them both for mosquitoes, flies, and also for cockroaches, nymphs who enter our house in the kitchen or in the bathroom. So we should take care that hygiene means that all such insects should be prohibited from entry, because they are the carriers of pathogens, and if we can prohibit their entry, we can prevent this insect borne diseases to a large extent. Then airborne diseases, I said, for that awareness is required that airborne diseases should not be spread by sputum or by droplets. Infected people should be advised to cover their nose and mouth, and also the healthy people need to understand that they should stay away from diseases that can spread through air. So such as cold, influenza, then TB, all such diseases we need to handle with care so that they do not spread from the infected to the healthy person. Now, coming to categories of health organization, as I said, there are many, there is a hierarchy. The first thing starts with you or personal hygiene, then it will go to community level, then the district level or any other local body, the national, and finally the global level. So, talking about the health organization, it starts with the local bodies which manage health at the city or village level. So as I said, they are the monitoring authorities. They look after that whether the health facilities which are available, they are functioning properly or not, whether or not the people are getting access to the basic amenities or the health facilities for which they are entitled to, and whether the health conditions or the health status of the dwellers of that village or city that is maintained or not. You might have seen that many times, especially during the monsoon season, representatives from the municipality come to your house door or house doorstep with card, dengue card, and they ask you questions, and they ask the guardian, maybe your father or mother, to put the signature, and before putting the signature they ask question whether anybody in your family is ill, whether anybody is suffering from fever, and if anybody is suffering from fever, for how many days for he or she is suffering from fever, is there any test for dengue or any type of blood test conducted for the fever that the family member is suffering from. So they conduct a complete survey, and because all these data are collected, and then the municipality, means the government of that city, takes steps. For example, they destroy all the sources of stagnant water in and around the neighborhood or around the city. That is done, and also they run a drive to actually spray. They spray the spraying agents, so that all the egg and the larva of the mosquito, they are killed, and also the bushes, they are cut, and all these things are done in order to ensure that the health of the people, they are maintained even in the season where the chances of breeding is the highest for such vectors. So we at our own level can help the government to ensure the status, because if we take care of these measures, such as not keeping any stagnant water source, and then not dumping the garbage of our homes outside our colony or just near to our house, or not then taking steps or informing the local body to cut the bushes around the neighborhood, so that it doesn't become the dump yard or the breeding ground, all those things. And if there is any water body, such as any pond or lake nearby, so it should be taken care that it is either covered, or as it is sprayed with the insect or the larva killing agents, so that they do not encourage the growth of the insects or mosquito larvae. So we can help the government with the small steps, and also with the information that they need to gather in order to take the actions in this regard. Then comes the national organization. So from the name itself, you can understand that they work on health at the national level to improve overall well-being. So they collect the data from all the local bodies. As I said, that is the hierarchy. It is not possible for the national bodies of each country to go into each and every area and collect the data from each and every house. So they take the data from the local bodies who have already collected the data of health from each and every doorstep. Then they, according to the data collected by them, they do the analysis, and then they monitor what action they need to take, or what type of steps they need to take in order to upgrade the health status, or if it is fine to maintain that health status. Then after national, we come to international organizations. They now take the data from the national organizations in their system to focus on global health concerns. For example, we very recently faced COVID-19, and then the data from each country was collected by WHO to monitor that which country needs vaccine, which country needs the aid from the WHO, and in which country the mortality rate is going very high and in which country the mortality rate is manageable. That is the way that they focus to bring about the over or to come to the decision that what type of help needs to be provided and what assistance they can extend to such countries in order to upgrade of that country's health status, or in order to help that country come out of that pathetic condition of pandemic, so that the people or the citizens of that country can live a healthy life. Now, coming to international health bodies, as I said, two main international organizations that this chapter will focus on, they are Red Cross and World Health Organization. Coming to the Red Cross, it is both a national and international agency. Now, it was founded in 1864 and its main focus was to alleviate, means to remove or eradicate human suffering during peacetime and wartime. So what they actually did, that after World War, so they became operational and they did not take into account that whether the victims were of their own country or of the country that their own country were fighting against. So they treated all the victims of war in the same manner, because all of them were heavily injured and they were given the same type of medical treatment to get cured. They were all the soldiers who were injured and they were looked after in the same manner. Now, emblem of Red Cross, you know that it is a red colored cross on a white background. They mainly used to operate on battlefields and they helped the wounded soldiers to recover regardless of their side. This is very important. This was their humanitarian ground, that they will not consider the country for which that soldier was fighting for. So for them, each and every soldier is the victim of war and they will treat each and every soldier in the same manner. So it has been active even in helping during natural disaster and other emergencies such as famine or drought conditions. But mainly they are famous for healing the soldiers of wartime. Now, the main functions of the Red Cross to extend relief and help to victims of any calamity such as flood, fire, famines, or earthquakes. For any natural calamity, they will go and provide food, water, and other supplies to and the medical treatment, whatever they require in case of natural calamity or for the war condition. Now, also they provide first aid. We know first aid means the first help before the victim is carried to the hospital nearby or to any medical facility. It is very much needed to treat that person at the first hand, so that, for example, if any victim is bleeding profusely, so by the time he will be carried to the nearby hospital, that patient might be dead due to overbleeding. So for the first aid, we need to stop the bleeding or provide any blockage so that the blood is clot. Then for the proper overall cure, we can carry that patient to the nearby hospital for the next set of treatments. But firstly, we need to stop the bleeding so that the person is at least alive till the time that the doctor comes to treat that person. Then educate people on accident prevention. They also educate people that how they can avoid accidents, what precautions they need to take so that they can avoid accidents, and how they should be aware of the different rules to follow so that accidents become very less. Then arrange for ambulance services in emergencies. We know how ambulance facilities become very scarce in case of emergencies. So the Red Cross Society, since they have many contacts, they arrange for ambulances. They also have their own set of ambulances so that the victims are they get the medical facilities, or they are carried to the nearby hospital as soon as possible. Care for mothers and children by working in maternal and child welfare centers. So this sector is also looked after. This is very important because child mortality and then mother mortality rate were very high in early days when the awareness or the medical facilities were not so advanced. So at that time, they came into the picture to take care of the children as well as the mother by working in the maternal and child welfare center. They provided the medicine, they provided the knowledge, they provided the care. So in this manner, they help to look after both the mother and the child. Then special focus was midwifery. What is this midwifery? Means that they are the nurses who take care of the mother and the child after the child is born. So those type of nurses, and the profession is known as midwifery, and the people or the professionals engaged in this, they are known by midwives. So they also train the midwives. So they are like the network. So they provide the care on their behalf, and also they train many midwives so that when they will go to their own area, they can help to tackle the emergencies as well as the health issues of their own area. So they provide, so they help in two ways. Number one, they take care on their own responsibility, and also they provide training to the other professionals so that they can take care in their own particular regions also. Now, Red Cross Day is observed on 8th May every year. Now, and the Red Cross symbol is sometimes misused by hospitals because that is very common symbol. We know that the symbol of the cross means the symbol of the Red Cross or the treatment or hospital, but it's not legally authorized to be used by anybody. Only the members of the Red Cross Society, they can use this symbol of a red cross on a white background. Now coming to the second health organization, that is World Health Organization. Very common, all of you have heard this name. The World Health Organization was established in 1948. This date is very important, and it comes under the umbrella organization of UNO or United Nations Organization, and it works to promote global health and respond to health crisis. Whenever there is any outbreak of endemic in any country, so that report or information goes to World Health Organization, and World Health Organization immediately collects the data of mortality and the treatment provided there, and if it has got any access to any vaccine that can help tackle that endemic of that country, then it provides the access, and also it provides the monetary fund so that that country can come out of their health crisis. So in every manner it tries to help the member countries, means all the countries who are the members of the UNO or the WHO, it helps its member countries to handle the health crisis situation, and also it looks after the development of the vaccines, then the spread of the diseases, then we can say transboundary, then import and export of medicines as well as vaccines, the rules and regulations, whether they are followed or not. So all these things are looked after by the data submitted to the WHO, who works to combat diseases, improve global health standards, and respond to health emergencies around the world. It partners with countries and other organizations to address the health inequalities. Now we know that the developed countries, they have access to all the facilities in regard to the medical department, but the developing countries or the underdeveloped countries, they are still suffering for the lack of fund majorly, and also for the lack of access to those medical facilities. So there is the inequality. Now this inequality barrier is somewhat balanced by WHO. They ask the developed nations to help the developing and the underdeveloped countries so that they can meet the demands for their medical facilities or medical fund, development of vaccine, development of any drug or distribution of the drug, for all these major purposes, or to if they or if any developed country has got any vaccine for any endemic, then they are requested to send the vaccines so that the outbreak of that disease can be handled efficiently. So all these things are looked after. This connection between the developed countries and the developing and underdeveloped countries, the link is created in regard to the medical sector by the WHO. Why WHO was formed? It was created by UNO to address global health issues, focusing on research and rapid disease control, especially in poorer nations. This is very important to know that, for example, cancer. Now we know that nowadays cancer can be treated up to the third stage depending on many situations, many factors are there, the gender, the other comorbidities, the strength of the patient, or many other factors, but still there is still a chance, a ray of hope. But earlier there was no answer to cancer. Now who has made us able to give answer to cancer? This WHO, because they also carry out the research so that new, as I said, new medicines, new vaccines can be developed, and what is the trend of disease outbreak in each country. So accordingly, what can be the possible causes so that that disease can be reversed. Each and every angle is looked after by the researchers and the scientists who are working under WHO. Now the headquarters and regional offices of WHO, there are 6 total regional offices globally, and one office is also there in New Delhi in India. But if we talk about the headquarter, it is there in Geneva, Switzerland. For Red Cross also, the headquarter is in Geneva, Switzerland. For both of these organizations that we are discussing, the headquarter is in Geneva, Switzerland. Then the member countries report on major diseases such as malaria and smallpox. We know that smallpox has been eradicated from the world because of the vaccine development. So like this, there is always an endeavor to eradicate all such diseases from the world which are deadly, such as measles, then this malaria, this dengue. But the thing is that due to the increasing population, it becomes very difficult for the medical facilities to be accessed by the ever growing population. But and also the cost that cannot be afforded by the common people. So the focus of WHO is to make the medical facilities accessible as well as affordable for all the citizens of the country, not only for the developed nations but for the developing nations as well. Main activities of the WHO include all these things, that is data collection, that gathers and shares information on endemic diseases such as cholera, typhoid, yellow fever or dengue, and then research support for the development of the highly advanced treatment methods, maybe Ayurvedic, maybe allopathy, maybe Unani, whatever it is. Then medical advances provides updates on vaccines, cancer. So if there is any information on the recent development, so the work of WHO is dissemination of the information as well, so that this information, that recent advancement has been there and there is another ray of hope, this information should reach all the associated members. That is also looked after by WHO. Quarantine guidelines. We know that during COVID, we were asked to stay in quarantine or complete isolation for 2 weeks or 14 days, because that was the incubation period during which the symptoms of COVID-19 would appear had you been infected. So similarly, all these guidelines come from WHO only, that for which type of disease, how many days should be the quarantine period, so that is decided by the WHO. Drug standards, this is very important. The pharmaceutical companies refer to the drug standards set by WHO if they wanted to market any drug worldwide or even nationwide. So the actually the standardization authorities, they match the characteristics or the traits of the drug with the rules and the protocols set by the WHO, and if the drugs do not pass that test, that drug is not given the approval for marketing. But the drugs whichever are available in the market, they should pass the standards and the protocols set by WHO, which will ensure that the drug is pure and the correct dosage of the active ingredient is present in the drug in order to cure the particular disease. Then disease campaigns, they are also organized by WHO. This is an effort to control widespread and local diseases. So this is done to spread awareness, basically, that how at the personal level or at the community level we can do our bit to bring about major changes in the society. So that is only the message for all such disease campaigns. Now these disease campaigns focus on a particular disease, maybe malaria, maybe dengue, maybe cholera, maybe typhoid, and accordingly they suggest the major guidelines that for which in case of inner emergency, what are the things that we can do without getting panicked. So this is all about this health organization chapter. I hope I could give you a good insight on both of these organizations, that is World Health Organization and Red Cross Society. Should you have any question regarding them, please comment us and get connected with our Fun Scholar team to know more on this. Thank you so much for your patience. We'll meet again with another topic. Till then, take care. Goodbye. And I am Shushmita ma'am signing off.